Okay, let's jump in. When you think of Rome, what comes to mind? The Colosseum, maybe? Trevi Fountain?
Emperors, gladiators,
Hmm,
it's this incredible tapestry of history.
exactly. History everywhere you look. But there's another story, woven right into the city's foundations, one we don't always think about.
And that's healthcare. It's evolution over time.
Right. So this deep dive, it's all about Rome's healing journey. It's fascinating how it kind of mirrors the city's own story, its rise, fall, and, well, its comeback across the centuries.
Yeah, we're going to trace that path from, really basic household remedies in ancient times,
Through to the big public health projects of the empire.
and then fast forward right up to the medical care available today, especially for you, the visitor, the global traveler.
And our mission here is really to guide you on that journey. We've dug into our sources to pull out the key bits of knowledge.
The goal is to help you understand how these medical systems, old and new, actually worked for people, residents, non-residents, everyone.
From gladiators needing battlefield care right up to, say, modern telemedicine. Think of it as your shortcut to getting up to speed on this vital but often hidden side of Roman life, ancient and modern.
Okay, so let's start way back. Part 1, Ancient Rome.
Picture it. Rome at its absolute peak, a massive city, over 1 million people. It's the center of everything: trade, power, military campaigns.
And with that density, that constant movement of armies, well, some kind of medical attention wasn't just nice to have, it was essential. For stability, for survival, really?
So what did early Roman medicine actually look like before the professionals came along?
Well, initially it was very much a family affair. The pater familias, the male head of the household, he was the main healthcare provider.
For his whole household,
Yeah.
including slaves.
Yep, the entire extended family, dependents, enslaved people. His knowledge was based on practical experience, herbal remedies, often grown right there in the garden.
And mixed with a fair bit of superstition, too, I imagine.
Oh, definitely. Prayers, rituals, amulets.
Mm.
Seeking help from the gods was a big part of it.
It's interesting how that practicality shines through, though, like Cato the Elder.
Ah, yes. Back in the 3rd, 2nd century BCE.
His big thing was cabbage, wasn't it? A cure-all for everything from, what, constipation to deafness?
Pretty much. It sounds almost comical now, but it really shows that Roman emphasis on, practical, self-reliant solutions within the family unit before things got more formalized.
But then things did start to change. The Greeks arrived.
Exactly. That was a huge turning point. From around the 3rd century BCE onwards, Greek culture and critically Greek physicians started flowing into Rome.
Were they welcomed immediately?
Not really. Romans were actually quite suspicious of these foreign doctors at first. There was a bit of cultural resistance.
But they couldn't ignore the results, I guess.
Precisely. They gradually recognized that the Greeks had, well, a more advanced systematic approach, more knowledge.
So who are the key figures?
One name that really stands out is Asclepiades of Bithynia, around 120 to 40 BCE. He was a Greek physician, and he advocated for something quite revolutionary at the time.
Which was?
A gentle, patient-focused approach. Things like diet, exercise, massage, even music therapy, hot and cold baths. The big idea was causing minimal pain.
Wow, that does sound different. Almost modern in a way.
It was a real shift. And bringing in Greek medicine also meant bringing in Hippocratic ideas.
So observation, diagnosis, looking for natural causes.
Exactly. Moving away from just blaming everything on angry gods. It was a philosophical shift, too, and it started to align medicine with that Roman talent for organization.
Did this lead to actual professional doctors?
Yes, slowly but surely. Medicine began to professionalize. You started seeing medici physicians setting up private practices, maybe in little shops called tabernae.
And the wealthy could afford their own.
Right. Wealthy families might employ a medicus domesticus, a household doctor.
Okay, but let's talk about what Rome is maybe most famous for in this area. Public health. Sanitation. That was really their standout contribution, wasn't it? Way ahead of its time.
Absolutely. This wasn't just about individual doctors. It was about city-scale solutions, driven by the sheer necessity of keeping over 1 million people relatively healthy in one place.
And they did it with incredible engineering. The aqueducts, for starters.
It's just phenomenal. Miles and miles of channels bringing fresh, clean water right into the heart of the city, supplying fountains, public baths, even some private homes.
Which must have drastically reduced waterborne diseases.
Hugely significant impact. And then you have the sewers, like the famous Cloaca Maxima.
An ancient mega sewer.
Basically, yes. Draining waste away from the city center, down into the Tiber River. It wasn't perfect by our standards, obviously, but for the time. An incredible feat of engineering for urban hygiene.
And the public baths, the thermae, they weren't just for getting clean.
Oh, far from it. They were massive social hubs, places for exercise, relaxation, socializing, and yes, hygiene, promoting cleanliness on a grand scale.
It's amazing how effective all this was, even without understanding germ theory. They wouldn't figure that out for, what, nearly 2,000 years?
Exactly. It was practical problem solving on a massive scale.
Oh,
And speaking of large-scale organization, the military was another huge driver.
makes sense. You need healthy soldiers to run an empire.
Absolutely critical. And this need led to probably the earliest form of organized hospitals we know of.
The valetudinaria.
That's them. These are military hospitals, set up from around the 1st century BCE, usually inside the army forts along the frontiers.
What were they like inside?
Surprisingly sophisticated. They often had dedicated rooms maybe for surgery or for soldiers recovering. They practiced triage, sorting casualties by how severe their injuries were. There were sanitation efforts.
And specialized staff?
Yes, you had medici, the doctors, but also kepsarii, who were more like first aid specialists or orderlies, and probably people acting as nurses. They even had portable field hospitals for when the army was on campaign. Military camps themselves were designed with hygiene in mind.
So we have these impressive public works, military medicine, but what about the average person? What was access to healthcare like for, say, a regular citizen or even a slave?
Ah, well, that's where you really see the social divisions. Access was definitely stratified,
So the rich got the best deal.
naturally. Wealthy citizens could afford private physicians, specialized treatments. They had the best access by far.
And the common folk, the plebes.
Much more limited. They'd rely mostly on that traditional family care we talked about, folk remedies, maybe visiting a public temple.
Like the one dedicated to Aesculapius, the god of healing.
Exactly. The famous temple on Tiber Island in Rome itself. People would go there and sleep in the temple precinct, hoping for a dream from the guide telling them how to get cured. This practice was called incubation.
So no real public hospitals for civilians back then.
Not in the way we think of them. Widespread civic hospitals really only started appearing later, around the 4th century CE, often linked with the rise of Christianity and its emphasis on charity.
What about enslaved people? Did owners provide care?
It varied. On large estates, sometimes owners would set up a kind of valetudinarium for enslaved workers, mainly to protect their financial investment in them. But otherwise, care depended entirely on the owner's goodwill, or lack thereof.
And foreigners, tourists of the ancient world.
They were pretty much on their own. They'd have to find and pay for a private physician if they could, or perhaps rely on local charity. There was no state system for visitors.
And the doctors themselves, were they all skilled surgeons?
Huh, probably not. The quality definitely varied. You had highly skilled practitioners performing surprisingly complex procedures.
Like what?
Well, sources mention things like cataract surgery, even cesarean sections, though survival rates were likely very low for the mother. Their surgical tools, scalpels, forceps, catheters, bone levers, look remarkably advanced.
We also had
Charlatans, yes, people selling useless remedies. And even with the best surgeons and tools, treatment still included things like bloodletting phlebotomy, or cautery, burning tissue to stop bleeding or treat growths.
and the biggest risk of all.
Infection. Without understanding germs, even a minor wound or successful surgery could easily become fatal. That was the constant underlying danger.
Okay, let's jump forward. 2,000 years, Rome today. The healthcare picture is obviously completely different.
Dramatically different. Italy has a universal public health care system, the Servizio Sanitario Nazionale, or SSN. It provides comprehensive care for Italian citizens and legal residents.
But, and this is the key question for many listeners, what about tourists? If you're visiting Rome, what do you need to know? Is it free?
Right. This is crucial. Healthcare is not automatically free for all tourists. Now, emergency service is true. Life-threatening emergencies will be provided to anyone, regardless of where you're from or if you have insurance.
But the follow-up care might cost you.
Exactly. Subsequent treatment, non-emergency care, that can definitely come with the bill.
Okay, so let's break it down. What if you're from the EU or EEA or Switzerland?
Then your e-keys card, the European Health Insurance Card, is your key. You absolutely must carry it. It proves you're entitled to medically necessary state health care on the same basis as an Italian citizen.
Meaning you pay the same fees, the co-payments, which they call ticket, or get free care if it's free for Italians.
Precisely. But you need that card as proof.
What about non-EU visitors, people from the US, Canada, Australia, the UK now?
For non-EU citizens, comprehensive travel insurance isn't just recommended, it's basically essential, non-negotiable.
And it needs to cover what specifically?
Medical emergencies, definitely.
Yeah.
Hospitalization costs, and importantly, medical evacuation or repatriation, which can be incredibly expensive if needed.
And you should expect to pay upfront for things.
Generally, yes, for non-emergency services.
Hmm.
You pay the clinic or doctor, then claim it back from your insurance provider later. Keep all receipts and documentation.
Is Australia any different? I heard something about an agreement.
Yes. Australia has a limited reciprocal agreement. It covers medically necessary care for sudden illness or accidents that happen during your stay, but only for the first 6 months you're in Italy.
But it doesn't cover everything.
No. Crucially, it doesn't cover pre-existing conditions, and is definitely not a substitute for proper travel insurance. It's a safety net for specific situations, not full coverage.
Can you give us an idea of costs, roughly, if you do have to pay?
Sure. An ER visit, pronto soccorso, might cost somewhere between, say, €50 and €200 for basic assessment and treatment if it's deemed non-urgent or you don't have an EH, but complex procedures or admission, that can run into thousands very quickly. A visit to a private GP might be around 80 to 150, maybe more.
Okay, so if you do need medical help in Rome, where do you actually go? Let's start with the serious stuff. Emergency rooms.
The pronto soccorso. These are attached to hospitals and are strictly for genuine life-threatening emergencies. Think heart attacks, serious accidents, difficulty breathing.
What happens if you go there with something minor, like a sprained ankle or a bad cold?
You will likely face a very, very long wait. Hours, potentially many hours. They use a triage system to prioritize patients.
How does that work?
They'll assess you quickly and assign a color code. Red is critical, life-threatening. Orange means vital functions are at risk. Cyan is stable, but complex care needed. Green is stable, minor issue. And white is non-urgent.
So if you get a green or white code...
Expect to wait a long time, because
Okay.
they will always see the red and orange patients first, obviously. To get there, you can call 112, that's the Universal European Emergency number for ambulance, police, fire, or just go directly to the nearest hospital ER if you can.
Are there specific hospitals that are good for tourists? Maybe with English support?
Yes, some are better equipped for international patients. The Policlinico Universitario Agostino Gemelli is huge, one of the biggest in Europe, and it has a dedicated international patient office, which is really helpful. Ospedale San Camillo Forlanini is another major public hospital. Ospedale Fate Benefertelli is interesting. It's actually on Tiber Island, the same island as that ancient healing temple, believe it or not, and it has a long history of care.
Any private options?
Salvatore Mundi International Hospital is a well-known private hospital that specifically caters to international patients, so English is widely spoken, but it will be more expensive.
Okay, what about less serious things? If you get a cold or a minor infection or need a prescription refill, you shouldn't go to the ER.
Definitely not.
Hmm.
For non-urgent issues, especially during tourist season, there's a specific service called the Guardia Medica Turistica.
The tourist medical service.
Exactly. It's designed specifically for tourists with minor non-emergency problems. Think colds, flu, minor cuts, sprains, needing a repeat prescription for something simple.
Where do you find these?
They're usually set up in central tourist areas or sometimes within the offices of the local health authority, the ASL. Their locations and hours vary, but they typically operate during the peak summer months, often with daily hours like 8 a.m. to 8 p.m.
And is it expensive?
No, it's very affordable. There's usually a fixed consultation fee, maybe around 20 to 35, which is much less than a private doctor or a potentially unnecessary ER visit.
Good to know. What about pharmacies? Pharmacy, you see them everywhere with that green cross sign?
Yes, they're very accessible. And Italian pharmacists are highly trained professionals. They can give excellent advice for minor ailments, coughs, colds, indigestion, minor skin issues, and recommend over-the-counter medications.
But they can't just give you anything, like antibiotics.
No, that's a key difference from some countries.
Yeah.
Antibiotics and many other types of medication absolutely require a prescription from a doctor in Italy. You can't just buy them over the counter.
What if you need a pharmacy at night or on a Sunday?
There's always a farmacia di turno, a duty pharmacy open in each area. Every closed pharmacy will have a sign posted on its door listing the nearest open ones.
So you can always find one.
Yes, especially in a big city like Rome. Some large pharmacies in central busy areas might even be open 24/7, though sometimes with a small surcharge for night service.
And the final option is private clinics or doctors.
Right. You can find private medical centers and individual doctors who speak English. You'll usually get an appointment quicker than waiting at the Guardia Medica Turistica. and have less waiting time. But naturally, it will cost more.
So even with all these options, it feels like there are still hurdles for tourists, right?
Definitely. The language barrier can be a real issue, even if some staff speak English. Just navigating an unfamiliar system when you're feeling sick is stressful.
And those long waits at the public ER for anything non-critical.
That's a big one. Plus, you're on holiday. You have limited time. Spending half a day in a waiting room is the last thing you want. It can really disrupt your plans.
Which brings us to how things are adapting now. Just like ancient Rome built aqueducts to solve its problems, modern Rome is seeing new solutions emerge for today's visitors.
Exactly. And telemedicine is a really interesting example we found in our sources, offering a way to bridge that gap for travelers needing quick, non-emergency help.
So instead of you going to the doctor comes to you, virtually.
Pretty much. Services like Pyllola Telemedicine, for instance, are designed to bring medical consultation right to your phone or laptop, wherever you are, your hotel, your Airbnb, even sitting on a bench if you need to.
How does that actually work? Is it complicated?
No, the whole point is convenience. Typically, you just go to their website, no need to download an app usually, which is great if you're worried about phone memory or data.
And then?
You fill out a simple online form, describe your symptoms in English. They're designed to be quick, no lengthy registration.
And you get an English-speaking doctor.
Yes, that's a key feature. They guarantee consultations with certified Italian general practitioners who are fluent in English. So you avoid that whole language barrier problem right away.
How fast is it?
Usually very fast for non-emergencies. Often you can be connected for a face-to-face video call within about 15 minutes.
Wow. And if you need medication?
If the doctor decides you need it, they can issue a valid Italian digital prescription. It gets sent straight to your phone or email.
And you can just take that to any pharmacy.
Any farmacia in Rome or anywhere in Italy, yes. They can scan the barcode or read the details and dispense the medication. It's integrated into the Italian system. It's kind of like having that knowledgeable pater familias again, but accessible globally through tech.
That really does seem to tackle those tourist challenges we talked about.
It does. The convenience is obvious. No travel, no waiting rooms when you feel unwell.
Immediate access for those minor but disruptive things, like a sudden fever or infection.
Exactly. Overcoming the language barrier is huge for clear communication and peace of mind.
And cost-wise, compared to a private visit.
Often for these kinds of consultations, it can be more cost-effective and certainly saves a lot more time than arranging and attending an in-person private appointment.
It sounds like it gives you back control, lets you get help quickly without derailing your trip.
That's the idea. Peace of mind. Knowing you can get professional English-speaking advice quickly. Let's talk about Sarah's story from one of the sources. It illustrates this perfectly.
Okay, what happened to Sarah?
She was in Rome, had a fantastic day exploring, but then started feeling unwell, coughed, sore throat, a bit of a fever. Her big Vatican tour was planned for the next day, and she thought, oh no, this is ruined.
Classic tourist nightmare. And her first thought was panic about finding a doctor.
Exactly. How to find one, explained her symptoms in Italian. But then she remembered using a telemedicine service before, actually on a trip to Capri. She had had a good experience.
So she tried Pyllola.
Yes. Right there from her hotel room near the Pantheon. She went onto their website, typed in her symptoms in English.
And got a quick response.
Yeah. Very quickly, she was in a video call with an English-speaking Italian GP.
And what was the outcome?
The doctor listened, asked a few questions, diagnosed it as a common viral infection. Nothing serious, but definitely needing some relief. Gave her clear advice on rest, fluids.
Did she need a prescription?
Yes, the doctor prescribed a standard Italian cough syrup and some throat lozenges, and the digital prescription appeared on her phone almost instantly.
So, no need to leave the hotel while feeling sick, no taxis, no language struggles.
None of that. She just rested a bit, then took a short walk to the nearest pharmacy down the street, showed her phone screen, and got the medicine.
And the Vatican tour.
By the next day, she was feeling much better, managed the tour, and didn't lose that precious vacation time. The service saved her not just time, but also a huge amount of stress and uncertainty.
That's a great example of how these modern solutions fit in.
It really is.
So, wrapping this up, it's incredible to track this thread of healthcare through Rome's entire history.
It really is. From the pater familias taking care of his household,
To the army building those early valetudinaria.
from the amazing public baths and aqueducts.
Right up to today's sophisticated national health service and these innovative telemedicine options, Rome's commitment to well-being in different forms has always been there.
Yeah, what started as, domestic remedies and groundbreaking public engineering has evolved into this complex modern system, a
Mm.
system that's excellent for residents.
But, as we've seen, can have some practical hurdles for visitors from abroad.
And services like telemedicine are just the latest adaptation, really. Rome finding new ways to serve the people within its walls, including its millions of temporary guests from around the globe.
Making sure that your trip to the Eternal City can stay healthy, happy, and hopefully truly unforgettable.
So, a final thought, maybe. What other aspects of our daily lives, things we rely on today, do you think have roots stretching back millennia, constantly evolving and adapting, just like healthcare in Rome, to meet our modern needs? Something to ponder.